Thanks, Kylie, and thank you for having me, and welcome everyone on a beautiful Melbourne winter's day. I too would like to acknowledge that we are on the land of the Warrawong people of the Kulin Nation, and I'd like to pay my respects to any elders here today and all elders, both past and emerging. And I think it's always really important to remember that our first people have been here for over 60,000 years, and during that time they have been using medicine and medicinal plants for those thousands of years. And I think it's beautiful that we're talking about a medicinal plant that this weekend we will progress the knowledge on, and we will expand the knowledge base. And I think this is one of the most important things around medicinal cannabis in Australia, is education and knowledge. And when you look at the range of speakers that we have here today, it is incredibly fulsome. And as someone who's not a doctor, who's not a researcher, who's not a scientist, and who's not an expert, seeing where we are today to where we possibly were probably 5 years ago when we were speaking about medicinal cannabis, it is such a more sophisticated conversation, and we have gone well past those preliminaries, and just looking at things like being able to talk about the endocannabinoid system and be able to say that actually without stumbling. Many of my colleagues still can't do that, but to be talking about the gut, moods, and those sorts of issues, which are really just emerging some in science, let alone in medicinal cannabis. And to see my friend Dr Sue Sisley here is wonderful, and the work that she has been doing with PTSD and with anxiety is truly remarkable. But I think all of the doctors and researchers and experts that are providing us, sharing their knowledge here today, will leave us all in a better place, and I'm very much looking forward to it. But although we're getting the word out, we know that is not the only reason that our cohort of patients and Australians being able to access medicinal cannabis is still so small. We was reading something where they're boasting about 9,000 patients. I would question that. I would suggest that there might have been 9,000 prescriptions written, but certainly nowhere near 9,000 patients have legally been able to access medicinal cannabis. We know that many more thousands of people are accessing cannabis for health reasons from the black market, and what I like to call maybe the altruistic market. And it's a market where people are trying to do very much the very best things that they can. They're trying to produce in the very best circumstances, but without legislative change, we are not going to increase that cohort. And I think education is most important in changing the minds of others. I think we certainly need to be changing the minds of the medical profession, changing the minds of the public, and really starting to address, I think, some of the stigma that still surrounds medicinal cannabis. And I might talk about that a little bit later. But until we do that, I think to have a healthy industry, because when we talk about 9,000 prescriptions, that was for any number of different symptoms and any number of different illnesses. So to make this into a commercial industry, we still have work to go. And I think one place that I certainly try and help, but certainly it will be the work of all of you in this room to also expand on, is the education of politicians. Now, okay, they can't say endocannabinoid. Some of them can't say cannabis. And some of them say things like, I'm okay with medicinal cannabis, I'm absolutely fine with it because it's only CBD and you can't, it won't have any effect really. So if you want to do it, knock yourself out. Now, I don't know whether to educate them on that or just leave them and say, exactly, we should be all fine, it should be available at the chemist. over the counter. But then I've got other people who are saying, oh, as if they're just trying a sneaky way to get cannabis to use for purposes other than health. And before you know it, they'll be injecting it in their eyeballs. I kid you not, that actually was a statement made to me, that we would be injecting cannabis in our eyeballs. He also thought that that's how you took ecstasy. As I say, we do need some education up there in Spring Street. But I think what makes this conference so special, and I loved the way that Kylie introduced it, you know, medicinal cannabis and mental health. Now I can tell you, the minute I talk about medicinal cannabis, the visceral response is, yeah, but it causes mental health. We've got to be careful. Schizophrenia, don't you know? So it's almost like talking about cannabis and mental health is a taboo subject. So I think it's just remarkable and wonderful seeing what we're seeing here today. And I think what also gives me some optimism about this is the fact that St Vincent's Hospital has just started a psilocybin study into people with existential pain and end of life. Now, you know, this shows to me that the stigma around traditionally seen as illicit substances to be seen in a health perspective, but also in a perspective that can help with mental health. I am an optimistic person, but we also have to educate the doctors, and doctors, as you all know, and I know many of you are educating doctors and doing a wonderful job. But many of them are still sceptical. And I had a number of doctors came to see me just the other day, and they were representing the College of Anaesthetists, and particularly they were pain management specialists, and they really came in to tell me what for. You know, like, really, Fiona, you need to listen up, get the facts, and stop saying silly things about medicinal cannabis. They weren't necessarily against it, although they came armed with information to tell me that medicinal cannabis was not, you could not do anything with it, and that they certainly weren't going to do anything with it. But as we had the conversation and we talked about it, and they then recognised that a number of their clients were getting some very good responses to it, that they had anecdotal responses to it, that there was some evidence about the complementary effect that medicinal cannabis could have on some of the traditional medicines that they were using. And we kept talking about it. What they wanted was this magical molecule to come out of this plant that they could synthesise and put it into a pill and give it to someone with food 3 times a day. That's what they wanted. But as we talked about it, they recognised that this, well, I don't think it's a magical plant, I think it's an extraordinary plant. And that the value of all the different compounds and the terpenes and the cannabinoids and everything else in this plant, and how they complement each other. This is far more complicated than any synthesis of some, you know, molecule. And they left that meeting saying, well, why don't we just decriminalise it? And that probably leads me to finally a couple of areas that I'm working in Parliament. The first one is driving. Now, I know many doctors have said to me that one of the barriers to their patients taking medicinal cannabis is the fact that they could be restricted or prohibited from driving. Doctors will say if there is THC, and we know that we're being tested, that our random drug testing that we do in Australia is testing purely for a presence of THC. It's not testing for the impairment of impairment. I have made some inroads that if you have a prescription for a product, for a medicine, then that should be a defence if you're found with the presence of it. The same as if you have a prescription for OxyContin or you have a prescription for a benzodiazepine, that is seen as a defence to a presence charge, not an impairment charge. And we have been making some good progress in that, and I think that will, for some people, really change the game for them. Finally, we are running a cannabis inquiry. Now, I think this is going to be interesting, and I do ask these questions. How does a discussion about legal access to cannabis affect what you are doing in medicinal cannabis? Now, I have posed the question for this inquiry, and I'm chairing this inquiry, and it will be a substantial inquiry. And the question we have posed is, how do we keep cannabis out of the hands of criminals and children? Now, if you think that cannabis is the most evil substance that has ever grown on this earth, or you're pro-reform, that is a good starting question. But how does it, as I say, how does it affect the discussion on medicinal cannabis? Will it improve access if we do see legal access? Will it improve research opportunities? Will it reduce the stigma of cannabis? Or will it further stymie and stigmatise medicinal cannabis? Will it mean that doctors, again, will be even less likely to prescribe it? And I think these are really important questions to ask. And over the course of the inquiry, I hope that many of you will provide us with your thoughts on that. But what I do know is that we do need legislative reform for medicinal cannabis. We do need to change the stigma that surrounds cannabis, and what you are doing here will work towards that. And I think education, and I thank you so much for the opportunity to be here. I'm looking forward to learning a lot more. I thank you all for what you are doing, and I look forward to the rest of the conference.